मेरा नाम मिराजुद्दीन है। मैं मैकेनिक का काम करता हूँ। उम्र 42 साल।
मेरा नाम रुबीना है। मैं मिराजुद्दीन की वाइफ हूँ और हम लोग ओखला में रहते हैं। और मेरे हस्बैंड को ना ये प्रॉब्लम कम से कम 5 साल पहले से ही ये प्रॉब्लम थी। थोड़ा बीमार से रहते थे, कमज़ोर से होते जा रहे थे, तो ऐसे लाइटली ले लिया करते थे। कभी उन्होंने ये नहीं कहा कि डॉक्टर को दिखाना है, कुछ करना है।
This patient who was coming to us for last 9 months with heart failure, he could barely walk for 10 meters, and after walking for 10 meters he will become short of breath. So we told him that you have two options. One is left ventricular assist device. The other option in this patient is a heart transplant.
उन्होंने फर्स्ट टाइम में ही बता दिया कि आपका जो पेशेंट है ये हार्ट फेलियर है, इसको कभी भी कुछ भी हो सकता है। तो लेकिन उस टाइम मैं घबरा गई। फिर डॉक्टर साहब ने हमसे यही कहा कि एक बारी आप जाके डॉक्टर केवल किशन से मिल लो, मेरी बात मानो, आप मिल लो, मिलने में कुछ नहीं हो रहा।
And then that cardiologist referred to me in December 2014. When the patient came over here, I checked the pre-operative evaluation whether patient is fit for heart transplant or not. So during all the investigation for 2-3 days in Max Hospital Saket, we investigated him and found him to be eligible for heart transplant.
उन्होंने हमसे कहा देखो हार्ट मिलना इतना आसान नहीं होता, ये तो लक की बात है कि अगर ये किसी को मिल गया। हार्ट चेंज करने में ब्लड ग्रुप भी सेम होना चाहिए। बहुत सारी बातें ऐसी होती हैं जो सेम होनी चाहिए।
And then we kept him on the list by the time we get the new heart. But it was almost 6 months period, so he got admitted 3 times in between.
फिर डॉक्टर साहब ने हमसे बोला कि मैं आपके कांटेक्ट में रहूँगा, जैसी भी बात होगी मैं आपको बार बार तबीयत पूछता रहूँगा बीच बीच में, और जब कभी भी हार्ट मिलता है तो आपको 1 घंटे के अंदर हॉस्पिटल पहुँच जाना है। कहीं पर भी हो आप जल्द से जल्द कोशिश करके हॉस्पिटल पहुँच जाना।
On 31st of July around 10 o'clock, we got a call from B.L. Kapoor Hospital that we have a patient who has sustained road trauma, and is a road trauma victim who has brain death, and the family has consented for giving his body organs. So that for the noble cause, the team had counseled them and they agreed to donate the heart. And then we called Mirajudin that is he willing for the operation, and then we counseled him. He came to our hospital around 10:30, 11, and we started preparing him for the surgery. Simultaneously, we sent a team to B.L. Kapoor Hospital to procure the heart.
And I went over there to B.L. Kapoor Hospital where the donor was there. I evaluated the donor was fine, so I told the team over here in Max Saket that take the patient in for the surgery. When I brought the heart with the green corridor, we could reach only in 16 minutes to this hospital.
Because the biggest challenge we have in heart transplant is we have to do this surgery within 4 hours. So from taking the heart to restarting the heart, because we cannot really wait beyond that. If you wait beyond that, then the heart may not be good enough for starting in the next body.
And once we reached over here, then I inspected the heart, it's doing fine. So then I cut the diseased heart from the patient and put the newer heart with 5 anastomosis as the usual procedure, internationally accepted, all the things. I did it.
We started the surgery around 3:30 in the night, and we could complete the surgery around 6:37 in the morning, and we could retrieve the heart and transplant the heart in our hospital. And after that, it is around 7 days, the patient is doing pretty well. The biggest challenges in these patients is the post-operative immunosuppression. We have to give immunosuppression so that these patients do not have a heart rejection and infection.
And patient has been doing fine since then. He's walking all around, feeling more comfortable, and his life would be like a normal person for next 20 years.
वो सारी बातें सोच के ऐसा लगता है कि कितनी प्रॉब्लम में थे हम लोग, आज सब वो ख़त्म हो गई है।
See, the cardiology is a very important specialty. For heart failure patients now, you can also give them more specialized treatment, like We have a special 3-lead pacemaker. There's the LV assist device. Those who are not helped or are end-stage heart failure, that kind of, when we say that patient is so sick in heart failure, no options, that you have a LV assist devices, and then you have a cardiac transplant. So I think there's a broad kind of therapeutic help that you can give to all kind of patients with cardiac ailments.
So as we say that heart disease is a disease of lifestyle, because we call it modifiable risk factors. So smoking, alcohol, lack of exercise, obesity, these are the modifiable risk factors, and if we curtail that, then the risk of heart disease will come down. And I strongly recommend that the current generation should be educated about it. So healthy lifestyle should be inculcated right from the school, so that the burden of heart disease on our society comes down significantly.